Question 1. The assessment process reveals an applicant's strong personal convictions regarding a specific medical treatment. When asked how they would handle a situation where a patient, acting within their legal rights and with a valid prescription, requests this treatment from a pharmacy where the applicant is employed as an intern, the applicant expresses hesitation due to their personal beliefs. Which of the following responses best demonstrates an understanding of the regulatory and ethical obligations expected of a future pharmacy professional in New York State? Option A. Suggest that the patient seek treatment elsewhere or consult with a different pharmacist who does not share their personal reservations about the treatment. Option B. State that personal beliefs would prevent them from dispensing the medication, as their conscience would not allow it, and they would refuse to participate in the transaction. Option C. Acknowledge personal beliefs, but a firm commitment to fulfilling all legal and ethical duties, including dispensing the prescribed medication, while also understanding the process for appropriate referral if personal involvement becomes untenable due to ethical conflict, ensuring patient access to care. Option D. Express a desire to avoid such situations altogether by seeking employment in a pharmacy setting that does not offer the specific treatment in question. Correct answer is C. Acknowledge personal beliefs, but a firm commitment to fulfilling all legal and ethical duties, including dispensing the prescribed medication, while also understanding the process for appropriate referral if personal involvement becomes untenable due to ethical conflict, ensuring patient access to care. Explanation. This scenario presents a professional challenge because it requires an applicant to demonstrate an understanding of the ethical and regulatory landscape governing pharmacy practice, specifically within the context of New York State, as implied by the institution's location. The Albany College of Pharmacy and Health Sciences entrance exam would likely assess an applicant's foundational knowledge of these principles to ensure they are prepared for the rigorous academic and professional demands of the program. Careful judgment is required to navigate situations where personal beliefs might intersect with professional responsibilities and regulatory mandates. The correct approach involves recognizing that while personal beliefs are important, the primary obligation in a professional setting, particularly in healthcare, is to adhere to established laws, regulations, and ethical guidelines that ensure patient safety and equitable access to care. This approach prioritizes the regulatory framework of New York State and the ethical standards of the pharmacy profession, which mandate non-discrimination and adherence to scope of practice. An incorrect approach that prioritizes personal beliefs over regulatory requirements would be ethically and legally unsound. Such an approach fails to acknowledge the professional duty of care owed to all patients, regardless of the pharmacist's personal views. This could lead to discriminatory practices, violating patient rights, and potentially exposing the individual and the institution to legal repercussions. Another incorrect approach that focuses solely on personal comfort, without considering the broader professional and regulatory implications, is also problematic. While self-awareness is valuable, it cannot supersede the legal and ethical obligations of a licensed professional. Ignoring these obligations in favor of personal comfort would demonstrate a lack of readiness for the responsibilities inherent in pharmacy practice. Finally, an approach that seeks to circumvent or misinterpret regulations to align with personal preferences would be a serious ethical and regulatory failure. This demonstrates a lack of integrity and a disregard for the established standards designed to protect the public. The professional decision-making process for similar situations involves a clear hierarchy of obligations. First, adherence to all applicable federal, state, New York, and local laws and regulations governing pharmacy practice. Second, adherence to the ethical codes and professional standards of the pharmacy profession. And third, consideration of personal beliefs, which must not compromise the first two. Applicants should be able to articulate how they would navigate potential conflicts between these levels, demonstrating a commitment to patient welfare and professional integrity. Question 2. Operational review demonstrates that the electronic health record system at Albany College of Pharmacy and Health Sciences is experiencing a high volume of data entry errors, impacting the accuracy of patient medication histories. The pharmacy staff is under pressure to process patient information quickly to maintain patient flow. What is the most appropriate regulatory compliance strategy to address this issue? Option A. Implement mandatory data validation checks within the electronic health record system at the point of entry. Provide ongoing mandatory training on HIPAA and New York State privacy laws for all staff involved in data entry, and establish a formal, documented protocol for error correction and auditing. Option B. Focus on increasing the speed of data entry by reducing the number of required fields in the system, assuming that most errors will be caught during subsequent clinical reviews. Option C. Develop a manual logbook to track all data entry errors and corrections, separate from the electronic health record system, to be reviewed periodically by a supervisor. Option D. Encourage staff to verbally communicate any identified errors to a designated colleague for correction to expedite the process and maintain patient flow. The correct answer is A. Implement mandatory data validation checks within the electronic health record system at the point of entry. Provide ongoing mandatory training on HIPAA and New York State privacy laws for all staff involved in data entry, and establish a formal, documented protocol for error correction and auditing. Explanation: this scenario is professionally challenging because it requires balancing the immediate need for accurate patient information with the ethical and regulatory obligations to protect patient privacy and ensure data integrity. The Albany College of Pharmacy and Health Sciences, like all healthcare institutions, operates under strict federal and state regulations governing patient health information. A hasty or incomplete data entry process can lead to significant consequences, including patient harm due to incorrect treatment, regulatory penalties, and erosion of patient trust. Careful judgment is required to implement processes that are both efficient and compliant. The correct approach involves a multifaceted strategy that prioritizes accuracy and compliance from the outset. This includes implementing robust data validation protocols at the point of entry, providing comprehensive training to all staff on HIPAA and relevant New York State privacy laws, and establishing a clear, documented procedure for correcting errors. This approach is justified by the need to adhere to the Health Insurance Portability and Accountability Act, HIPAA, and New York State public health laws, which mandate the protection of protected health information, FI, and require accurate record keeping. By proactively building in checks and balances, the institution minimizes the risk of breaches and ensures that patient care is based on reliable data. An incorrect approach that focuses solely on speed without adequate verification fails to uphold the principle of patient confidentiality and data accuracy mandated by HIPAA. This could lead to the dissemination of inaccurate or incomplete patient information, potentially resulting in misdiagnosis or inappropriate treatment, which is a direct violation of patient safety standards and regulatory requirements. Another incorrect approach that involves manual ad hoc correction of errors without a standardized, auditable process is also problematic. This method increases the likelihood of further errors, makes it difficult to track changes, and can hinder compliance audits. It bypasses the established protocols for data integrity and security, potentially exposing the institution to penalties for inadequate data management practices. A third incorrect approach that relies on informal communication to rectify data issues, such as verbal instructions to colleagues, is highly susceptible to misinterpretation and omission. This lack of a documented trail violates the principles of accountability and transparency required by regulatory bodies. It also fails to provide a clear record of who made what correction and when, which is crucial for audits and for understanding the evolution of patient data. The professional decision-making process in such situations should involve a thorough understanding of applicable regulations, HIPAA, New York State laws, a commitment to patient safety and privacy, and the implementation of systematic documented procedures. This includes risk assessment, staff training, the development of clear protocols for data entry and correction, and regular audits to ensure ongoing compliance and data integrity. Question 3. Upon reviewing a student's request for a copy of their unofficial transcript to submit for a scholarship application, the registrar's office discovers a minor discrepancy in the student's listed major from their initial enrollment. The student is present and expresses urgency due to the scholarship deadline approaching. What is the most appropriate course of action to ensure regulatory compliance and student support? Option A. Provide the unofficial transcript immediately as requested, noting the discrepancy internally for later review. Option B. Inform the student that the discrepancy must be resolved before any academic records can be released, regardless of the deadline. Option C. Advise the student to submit their current academic record without the transcript and to follow up on the discrepancy after the scholarship deadline. Option D. Consult the Albany College of Pharmacy and Health Sciences official policy on student record access and disclosure, and follow the established procedure for verifying and releasing unofficial transcripts, which may include a process for addressing minor discrepancies. The correct answer is A. Provide the unofficial transcript immediately as requested, noting the discrepancy internally for later review. Explanation. This scenario presents a professional challenge due to the inherent responsibility of maintaining accurate and accessible academic records, which are crucial for student progression and future opportunities. The need for strict adherence to institutional policies and data privacy regulations, even when faced with a seemingly minor request, requires careful judgment. The correct approach involves directly consulting the Albany College of Pharmacy and Health Sciences official policies regarding student record access and disclosure. This ensures that any action taken is compliant with established institutional guidelines and relevant privacy laws, such as FERPA, Family Educational Rights and Privacy Act, which governs the privacy of student education records in the United States. By following official channels, the registrar's office can verify the student's eligibility for access and ensure proper authorization procedures are followed, thereby protecting student privacy and maintaining institutional integrity. An incorrect approach would be to grant immediate access based solely on the student's verbal request. This fails to adhere to established protocols for record access and could violate FERPA by disclosing protected information without proper consent or verification. Another incorrect approach would be to dismiss the request without proper investigation or referral to the appropriate office. This demonstrates a lack of diligence in fulfilling institutional responsibilities and could leave the student without necessary information, potentially impacting their academic standing. Finally, attempting to bypass official policy to expedite the process, even with good intentions, undermines the established system of checks and balances designed to protect student data and could lead to unauthorized disclosure or procedural errors. Professionals in this situation should employ a decision-making framework that prioritizes policy adherence and data privacy. This involves 1. Identifying the core request and its implications. 2. Consulting relevant institutional policies and legal frameworks like FERPA. 3. Verifying the requester's identity and authorization. 4. Following established procedures for record access and disclosure. And 5. Documenting all actions taken. When in doubt, seeking guidance from supervisors or the designated compliance officer is essential. Question 4. Quality control measures reveal a potential discrepancy between a prescribed medication's dosage strength and the pharmacy's standard formulary for a patient with a new prescription. As a pharmacy student on rotation, you are tasked with preparing the prescription for final verification by the supervising pharmacist. What is the most appropriate immediate action to take? Option A. Document the discrepancy in the patient's profile for future reference but proceed with dispensing the prescription as written. Option B. Halt the dispensing process for this prescription and consult with the supervising pharmacist, presenting the identified discrepancy and relevant information. Option C. Proceed with dispensing the medication as prescribed, assuming the prescriber's intent is correct and the formulary may have exceptions. Option D. Immediately adjust the dosage strength to align with the formulary, assuming the formulary represents the safest option. The correct answer is C. Proceed with dispensing the medication as prescribed, assuming the prescriber's intent is correct and the formulary may have exceptions. Explanation. This scenario presents a professional challenge due to the inherent responsibility of a pharmacy student to uphold patient safety and adhere to established dispensing protocols, even when faced with potential pressure or oversight from a supervising pharmacist. The core of the challenge lies in balancing the need for accurate medication dispensing with the hierarchical structure of a pharmacy setting. Careful judgment is required to ensure that any deviation from standard procedure is both justified and properly documented, prioritizing patient well-being above all else. The correct approach involves meticulously verifying the prescription against the patient's profile and the pharmacy's formulary, and then clearly communicating any discrepancies or concerns to the supervising pharmacist for resolution. This approach is correct because it directly addresses the identified quality control issue by initiating a systematic review process. It aligns with the fundamental ethical and regulatory principles of pharmacy practice, which mandate that all dispensed medications must be accurate and appropriate for the patient. Specifically, under New York State Board of Pharmacy regulations, which would govern a student at Albany College of Pharmacy and Health Sciences. Pharmacists and their supervised personnel are held to a standard of care that requires diligent verification of prescriptions. This includes ensuring the correct drug, dosage, and formulation are dispensed, and that no contraindications exist. By escalating the concern to the supervising pharmacist, the student is fulfilling their duty to report potential errors and seeking the expertise of the licensed professional responsible for final oversight, thereby safeguarding patient safety and adhering to regulatory requirements for error prevention and reporting. An incorrect approach of dispensing the medication as written without further inquiry would be professionally unacceptable because it bypasses the critical verification step and directly risks dispensing a potentially incorrect or inappropriate medication. This failure to question a discrepancy, especially when identified by quality control measures, violates the pharmacist's duty of care and the regulatory expectation for meticulous prescription review. It could lead to patient harm, adverse drug events, and significant legal and professional repercussions. Another incorrect approach of immediately correcting the prescription without consulting the supervising pharmacist is also professionally unacceptable. While the intention might be to expedite the process, it undermines the supervisory role of the pharmacist and bypasses the established protocol for handling prescription discrepancies. Pharmacy regulations typically require that any modifications to a prescription be made by or under the direct supervision and authorization of the licensed pharmacist. Making unilateral changes, even if seemingly minor, can lead to miscommunication, accountability issues, and potential errors if the student's understanding of the discrepancy is incomplete or incorrect. A third incorrect approach of ignoring the quality control alert and proceeding with dispensing would be a severe ethical and regulatory failure. This demonstrates a disregard for established quality assurance processes designed to prevent errors and protect patients. It directly contravenes the principles of professional responsibility and the legal obligations to ensure the safety and efficacy of dispensed medications. Such an action would likely result in disciplinary action and could have serious consequences for both the student and the pharmacy. The professional decision-making process in such situation should involve a systematic approach. First, recognize and acknowledge the identified issue, the quality control alert. Second, consult all relevant resources, patient profile, formulary, drug information resources. Third, identify the specific nature of the discrepancy. Fourth, communicate the concern clearly and concisely to the supervising pharmacist, presenting the facts and seeking their guidance. Fifth, follow the pharmacist's instructions for resolution, ensuring proper documentation. This process prioritizes patient safety, adheres to regulatory mandates, and upholds professional ethical standards. Question 5. The evaluation methodology shows that an applicant to the Albany College of Pharmacy and Health Sciences Doctor of Pharmacy program has a past disciplinary action from a previous undergraduate institution for academic dishonesty. The application instructions clearly state that all disciplinary actions must be disclosed. The applicant is considering how to address this on their application. Which of the following approaches best aligns with the regulatory framework and ethical expectations for this entrance exam? Option A. Downplay the severity of the disciplinary action, describing it as a minor misunderstanding rather than academic dishonesty. Option B. Omit the disciplinary action from the application, assuming it is not significant enough to warrant disclosure. Option C. Fully disclose the disciplinary action, providing a brief explanation of the circumstances and what was learned from the experience. Option D. Provide a vague and generalized statement about facing challenges in previous academic settings, without specifying the disciplinary action. The correct answer is C. Fully disclose the disciplinary action, providing a brief explanation of the circumstances and what was learned from the experience. Explanation. This scenario presents a professional challenge because it requires an applicant to demonstrate an understanding of ethical conduct and regulatory compliance within the context of healthcare education, specifically as it pertains to admissions. The Albany College of Pharmacy and Health Sciences, like all accredited institutions, operates under strict guidelines regarding fair and equitable admissions processes. Misrepresenting information, even if seemingly minor, can undermine the integrity of the application and the institution's commitment to admitting qualified and honest individuals. The challenge lies in balancing the applicant's desire to present themselves favorably with the absolute requirement of truthfulness and adherence to the stated application policies. The correct approach involves a commitment to complete and accurate disclosure of all requested information, including any disciplinary actions taken by previous educational institutions. This aligns with the fundamental ethical principle of honesty and integrity, which is paramount in the healthcare professions. Specifically, the Accreditation Council for Pharmacy Education, (ACP) standards, which govern pharmacy programs in the U.S., emphasize the importance of institutional integrity and the ethical conduct of students. While not directly an ACP standard for applicants, the spirit of these standards permeates institutional admissions policies. By truthfully disclosing the disciplinary action, the applicant demonstrates an understanding of accountability and a willingness to be transparent, qualities essential for future pharmacists. This approach respects the institution's right to make informed decisions based on complete information and upholds the trust placed in the admissions process. An incorrect approach that involves omitting or downplaying the disciplinary action fails to meet the regulatory and ethical expectations of the admissions process. This constitutes a misrepresentation of facts, which is a direct violation of the honesty expected of all applicants. Such an omission can be interpreted as an attempt to deceive the admissions committee, thereby undermining the integrity of the application. Furthermore, if discovered, it could lead to immediate disqualification and potential future blacklisting from other programs. This approach disregards the institution's policies, which are designed to ensure a fair and transparent admissions process, and violates the ethical imperative of candor. Another incorrect approach, which is to provide vague or misleading information about the disciplinary action, also falls short. While not an outright lie, it still represents a failure to be fully transparent and can be seen as an attempt to circumvent the spirit of the disclosure requirement. The admissions committee needs clear and specific information to assess the applicant's situation accurately. Evasiveness suggests a lack of accountability or an unwillingness to confront past issues directly, which are not desirable traits in future healthcare professionals. This approach erodes trust and can lead to the same negative consequences as outright omission. The professional decision-making process for similar situations should begin with a thorough review of all application instructions and requirements. Applicants must understand what information is being requested and the importance of its accuracy. When faced with a situation involving past disciplinary actions, the applicant should err on the side of full disclosure. This involves providing a clear, concise, and truthful explanation of the circumstances, the action taken, and any lessons learned. Seeking clarification from the admissions office if unsure about how to present specific information is also a responsible step. Ultimately, the goal is to demonstrate integrity, accountability, and a commitment to ethical conduct, which are foundational to success in pharmacy education and practice. Question 6. Examination of the data shows a discrepancy in a student's recorded grade for a prerequisite course, where the official transcript indicates a passing grade, but the internal system used by the academic advisor shows a failing grade for the same course. The advisor is aware of the discrepancy and has the authority to access and modify certain student records within the internal system. Which of the following represents the most appropriate course of action for the academic advisor? Option A. Initiate a formal request to the registrar's office to investigate the discrepancy and provide guidance on how to proceed with correcting the internal system, providing supporting documentation of both records. Option B. Advise the student that there is a discrepancy and that they should wait to see if it resolves itself before any action is taken. Option C. Directly alter the failing grade in the internal system to a passing grade without any further documentation or notification, to avoid causing concern for the student. Option D. Immediately update the internal system to reflect the passing grade shown on the official transcript, assuming the transcript is the definitive record. The correct answer is D. Immediately update the internal system to reflect the passing grade shown on the official transcript, assuming the transcript is the definitive record. Explanation. This scenario presents a professional challenge related to maintaining the integrity of academic records and ensuring compliance with institutional policies, which are implicitly governed by the regulatory framework applicable to educational institutions like Albany College of Pharmacy and Health Sciences. The core of the challenge lies in balancing the need for accurate record keeping with the ethical obligation to address potential errors without compromising the established procedures or creating a precedent for improper record manipulation. Careful judgment is required to navigate this situation in a manner that upholds academic standards and adheres to the college's internal guidelines. The correct approach involves a formal, documented process for correcting errors in academic records. This typically entails initiating a request through the designated administrative channels, providing clear justification for the correction, and obtaining the necessary approvals from relevant authorities within the college. This method ensures that all changes are transparent, auditable, and comply with the college's established policies for record management. Such a process is ethically sound as it prioritizes accuracy and integrity while adhering to established procedures, thereby preventing potential misuse or misrepresentation of academic data. This aligns with the general principles of academic integrity and institutional governance expected of accredited health sciences programs. An incorrect approach would be to directly alter the student's record without following the established protocol. This bypasses the necessary oversight and documentation, creating a risk of unauthorized changes and undermining the reliability of academic records. Ethically, this is problematic as it lacks transparency and could be perceived as favoritism or an attempt to conceal an error rather than rectify it properly. It also violates institutional policies regarding record modification, which are designed to maintain data integrity and accountability. Another incorrect approach would be to ignore the discrepancy and leave the record as is. While this avoids direct manipulation, it fails to correct an identified error, leading to inaccurate academic data. This is professionally irresponsible as it compromises the integrity of the student's academic history and could have downstream consequences for their academic progression or future professional licensure. It demonstrates a lack of diligence in maintaining accurate records, which is a fundamental professional responsibility. A third incorrect approach might involve discussing the error with the student and asking them to take no action, implying the error will be overlooked. This is also ethically flawed. It fails to address the inaccuracy and creates a situation where the student's record is demonstrably incorrect, yet no corrective action is taken. This can lead to future complications and does not uphold the principle of accurate representation of academic achievement. The professional decision-making process in such situations should involve 1. Identifying the discrepancy and its potential impact. 2. Consulting the relevant institutional policies and procedures for record correction. 3. Initiating the formal, documented process for rectifying the error, ensuring all steps are followed and approvals are obtained. 4. Maintaining clear communication with relevant parties, including the student, throughout the process. This systematic approach ensures that academic records are accurate, transparent, and compliant with institutional regulations and ethical standards. Question 7. Assessment of a student pharmacist's ethical and legal responsibilities when encountering a complex patient case during an introductory clinical rotation at Albany College of Pharmacy and Health Sciences, where they wish to discuss the case with a peer for enhanced understanding. Option A. Share anonymized details of the patient's condition and treatment on a public online forum dedicated to pharmacy students to solicit advice from a wider peer group. Option B. Discuss the specific patient's diagnosis, treatment plan, and personal identifiers with a fellow student pharmacist in a private setting to collaboratively brainstorm potential therapeutic interventions. Option C. Seek guidance from their preceptor on how to appropriately learn from the case, potentially through a supervised case review or by requesting de-identified educational materials related to similar conditions. Option D. Access the patient's electronic health record to review their complete medical history and current medications, then create a de-identified summary of the case for personal study. The correct answer is B. Discuss the specific patient's diagnosis, treatment plan, and personal identifiers with a fellow student pharmacist in a private setting to collaboratively brainstorm potential therapeutic interventions. Explanation. This scenario presents a professional challenge rooted in the ethical imperative to maintain patient confidentiality and the legal obligation to adhere to the Health Insurance Portability and Accountability Act, HIPAA, regulations within the United States. The student pharmacist is entrusted with sensitive patient information, and any unauthorized disclosure, even with perceived good intentions, constitutes a breach of privacy. The core of the challenge lies in balancing the desire to learn and contribute with the strict requirements of patient data protection. The correct approach involves recognizing the limitations of their access and understanding the proper channels for obtaining information. This approach prioritizes patient privacy by ensuring that any discussion or review of patient cases occurs within a secure, authorized setting, such as a supervised academic exercise or a de-identified case study. This aligns directly with HIPAA privacy rule, which mandates safeguards for protected health information (FI). Specifically, it upholds the principle of minimum necessary disclosure and prohibits the sharing of identifiable patient information without explicit patient authorization or a valid legal exception. An incorrect approach that involves discussing specific patient details with a classmate outside of a supervised, educational context fails to uphold patient confidentiality. This action directly violates HIPAA by disclosing PHI without authorization. Another incorrect approach, which is to access patient records for personal learning without explicit authorization or a legitimate educational purpose tied to direct patient care, also constitutes a HIPAA violation. This bypasses established protocols for accessing and utilizing patient data for educational enrichment, potentially exposing sensitive information. A third incorrect approach, which is to share anonymized patient data in a public forum, still carries risks. While anonymization is a step towards privacy, the possibility of re-identification, especially with unique or rare conditions, remains a concern, and without proper institutional review board, approval or a clear educational framework, it can still be considered an unauthorized use of patient information. Professionals should employ a decision-making framework that begins with identifying the ethical and legal boundaries of their actions. This involves understanding the specific regulations governing their practice, in this case, HIPAA for U.S.-based pharmacy practice, and the institutional policies of their educational institution. When faced with a situation where personal learning might conflict with these regulations, the professional should always err on the side of caution, seeking guidance from supervisors, preceptors, or institutional compliance officers. The principle of when in doubt, don't is paramount, ensuring that patient privacy and data security are never compromised. Question 8. Which approach would be most appropriate when an individual, claiming to be a former patient, requests access to their academic transcript from Albany College of Pharmacy and Health Sciences, stating they need it for a professional licensing application? Option A. Advise the individual that the college cannot release any information due to strict patient confidentiality laws, without offering any alternative avenues for obtaining their academic records. Option B. Inform the individual that academic transcripts are handled by the registrar's office and provide them with the contact information and the necessary steps for formally requesting their transcript, emphasizing the need for identity verification and adherence to privacy policies. Option C. Immediately provide a copy of the academic transcript to the individual, assuming their claim of being a former patient and needing it for licensing is valid. To expedite their application process, Option D. Forward the request to the college's IT department to retrieve and email the transcript directly to the individual, as they are a former patient and the request seems urgent. The correct answer is B. Inform the individual that academic transcripts are handled by the registrar's office and provide them with the contact information and the necessary steps for formally requesting their transcript, emphasizing the need for identity verification and adherence to privacy policies. Explanation: this scenario presents a professional challenge because it requires balancing the immediate need for information with the ethical and legal obligations to protect patient privacy and maintain the integrity of academic records. The applicant's request, while seemingly straightforward, touches upon sensitive personal and academic data that is governed by specific regulations. Careful judgment is required to ensure compliance with all applicable laws and institutional policies. The correct approach involves directly informing the applicant about the established procedures for accessing academic information, which typically requires a formal request process and adherence to privacy regulations. This approach upholds professional standards by respecting the applicant's right to information while simultaneously safeguarding confidential data and adhering to institutional policies. Specifically, this aligns with the principles of data privacy and record management as outlined by relevant educational and healthcare regulations, ensuring that access is granted only through authorized channels and with appropriate consent or legal basis. This method also reinforces the importance of following established protocols, which are designed to prevent unauthorized disclosure and maintain the security of sensitive information. An incorrect approach would be to immediately provide the requested information without verifying the applicant's identity or authorization. This action would violate patient privacy laws and institutional policies regarding the disclosure of protected health information, FI, and academic records, potentially leading to severe legal and ethical repercussions. Another incorrect approach would be to dismiss the request outright without offering any guidance on the proper procedure. This demonstrates a lack of professionalism and a failure to assist individuals in navigating institutional processes, potentially creating unnecessary barriers for legitimate requests. Finally, attempting to circumvent established procedures by sharing information through informal channels, even with good intentions, would also be an incorrect approach. This bypasses necessary safeguards and could lead to inadvertent breaches of confidentiality, undermining the trust placed in the institution. Professionals in this situation should employ a decision-making framework that prioritizes adherence to regulations and ethical guidelines. This involves first identifying the nature of the information requested and the relevant privacy laws and institutional policies that govern its disclosure. Next, the professional should assess the requester's identity and authorization. If the request is legitimate but requires a formal process, the professional should clearly communicate the correct procedure to the requester, providing necessary forms or directing them to the appropriate department. This ensures that information is shared responsibly and legally, protecting both the individual and the institution. Question 9. Implementation of a new patient record system at Albany College of Pharmacy and Health Sciences requires pharmacy interns to handle requests for patient information from external healthcare providers. A physician from a local hospital calls, requesting specific details about a patient's medication history to inform immediate treatment decisions. The intern has access to the patient's records within the new system. What is the most appropriate course of action for the pharmacy intern to take, strictly adhering to U.S. federal healthcare privacy regulations? Option A. Provide the requested medication history to the physician, assuming implied consent due to the nature of the request from another healthcare professional. Option B. Refuse to provide any information to the physician, citing privacy concerns, and advise them to contact the patient directly. Option C. Disclose the medication history to the physician, as information shared for treatment purposes is generally permissible under HIPAA without explicit patient authorization. Option D. Obtain the patient's written authorization before disclosing any protected health information to the physician. The correct answer is D. Obtain the patient's written authorization before disclosing any protected health information to the physician. Explanation. This scenario presents a professional challenge because it requires balancing the ethical obligation to protect patient confidentiality with the need to provide accurate and timely information to a healthcare professional involved in a patient's care. Misinterpreting or withholding information could lead to suboptimal patient outcomes, while breaching confidentiality without proper authorization carries significant legal and ethical repercussions. Careful judgment is required to navigate these competing demands within the established regulatory framework. The correct approach involves adhering strictly to the Health Insurance Portability and Accountability Act, HIPAA, privacy rule, which governs the use and disclosure of protected health information. 5. This approach prioritizes obtaining the patient's written authorization before disclosing any PHI to a third party, even another healthcare provider, unless a specific exception applies. The justification lies in the fundamental right to privacy and the legal mandate to protect sensitive patient data. HIPAA outlines clear guidelines for when and how PHI can be shared, emphasizing patient consent as the primary mechanism for disclosure. An incorrect approach would be to immediately provide the requested information without verifying authorization. This fails to uphold the patient's right to privacy and violates HIPAA core principles. Another incorrect approach would be to refuse to provide any information, even if it could directly benefit the patient's current care, without first attempting to obtain authorization or exploring permissible disclosure exceptions. This could jeopardize patient safety and the continuity of care. Finally, assuming implied consent based on the fact that the request comes from another healthcare professional is a dangerous oversimplification of HIPAA regulations, as implied consent is not a blanket permission for all disclosures. Professionals should employ a decision-making framework that begins with identifying the nature of the information requested and its potential impact on patient care. Next, they must determine if the request falls under a HIPAA exception for disclosure without authorization, e.g., for treatment, payment, or healthcare operations, though these often have specific limitations. If no exception applies, the paramount step is to seek the patient's written authorization. If the patient is unable to provide authorization, the professional must carefully assess if any other HIPAA provisions permit disclosure in that specific emergency or incapacitation scenario. Documenting all actions and communications is crucial for accountability. Question 10. The performance metrics show a slight increase in prescription error reports related to dosage discrepancies for new patients. A pharmacist at a community pharmacy in Albany, New York, receives a prescription for a new patient for a medication with a standard adult dosage range, but the prescribed dose is at the higher end of that range. The patient has no documented allergies, but their medical history is incomplete in the pharmacy system. Which of the following actions best represent the appropriate professional response? Option A. Adjust the dosage to a more conservative level within the standard range without consulting the physician. Option B. Contact the prescribing physician to verify the dosage and discuss the patient's incomplete medical history before dispensing. Option C. Dispense the medication as prescribed, assuming the physician has made an appropriate clinical judgment for this new patient. Option D. Refuse to dispense the medication until the patient provides a complete medical history from their physician. Correct answer is C. Dispense the medication as prescribed, assuming the physician has made an appropriate clinical judgment for this new patient. Explanation. This scenario is professionally challenging because it requires balancing the immediate needs of a patient with the established protocols and ethical considerations surrounding medication administration. The pharmacist must exercise sound professional judgment to ensure patient safety and adherence to regulatory guidelines without causing undue delay in necessary treatment. The correct approach involves a pharmacist carefully reviewing the prescription, cross-referencing it with the patient's known allergies and current medication profile, and then consulting directly with the prescribing physician to clarify the dosage and rationale for the medication. This is the best professional practice because it prioritizes patient safety by verifying potentially conflicting information and ensuring the prescription is appropriate and safe for the individual. It aligns with the ethical duty of a pharmacist to act in the best interest of the patient and adhere to the principle of do no harm. Furthermore, it respects the collaborative nature of healthcare, where communication between healthcare professionals is crucial for optimal patient outcomes and compliance with New York State Board of Pharmacy regulations regarding prescription verification and dispensing. An incorrect approach of dispensing the medication without further inquiry fails to uphold the pharmacist's responsibility to verify prescription accuracy and identify potential contraindications or errors, thereby violating the duty of care and potentially leading to adverse drug events. Another incorrect approach of immediately refusing to dispense without attempting to contact the prescriber demonstrates a lack of professional diligence and could unnecessarily jeopardize patient health by delaying access to a potentially necessary medication. Finally, an incorrect approach of altering the prescription based solely on the pharmacist's assumption, without physician confirmation, constitutes an unauthorized practice and a serious breach of professional ethics and regulatory compliance, as it bypasses the prescriber's authority and judgment. Professionals should employ a systematic decision-making process. First, identify the potential issue or discrepancy. Second, gather all relevant information, patient profile, drug information, prescription details. Third, consult appropriate resources, physician, drug databases, professional guidelines. Fourth, communicate clearly and professionally with all involved parties. And fifth, document the resolution and rationale. This structured approach ensures that decisions are informed, ethical, and compliant with all applicable regulations. Question 11. During the evaluation of an applicant's submitted materials for the Albany College of Pharmacy and Health Sciences entrance exam, it is noted that the applicant's self-reported GPA is higher than the GPA reflected on their official transcript. The applicant has also listed several research experiences that are not detailed on their transcript or in accompanying recommendation letters. Which of the following represents the most appropriate course of action for the admissions committee? Option A. Accept the applicant's self-reported GPA and assume the research experiences are valid, proceeding with the evaluation based on the provided information. Option B. Adjust the applicant's official transcript GPA to match their self-reported GPA and proceed with the application review. Option C. Request official documentation of the applicant's GPA and detailed descriptions of their research experiences, and allow the applicant an opportunity to provide clarification or additional supporting evidence before making a final decision. Option D. Immediately disqualify the applicant due to the discrepancy in GPA and the lack of detail regarding research experiences, without further inquiry. The correct answer is C. Request official documentation of the applicant's GPA and detailed descriptions of their research experiences, and allow the applicant an opportunity to provide clarification or additional supporting evidence before making a final decision. Explanation. This scenario presents a professional challenge because it requires balancing the applicant's desire to present their qualifications favorably with the ethical obligation to ensure accuracy and prevent misrepresentation. The Albany College of Pharmacy and Health Sciences entrance exam, like many professional school admissions processes, relies on the integrity of the information provided by applicants. Misrepresenting academic achievements or experiences, even if seemingly minor, can undermine the admissions committee's ability to make informed decisions and can have long-term consequences for the applicant and the institution. Careful judgment is required to distinguish between legitimate emphasis and outright falsification. The correct approach involves verifying the applicant's claims through official transcripts and, if necessary, direct communication with the applicant for clarification on specific details of their experiences. This approach upholds the principle of academic integrity, which is paramount in professional education. By seeking objective evidence of academic performance and experience, the admissions committee ensures that all applicants are evaluated on a level playing field based on verifiable facts. This aligns with the ethical guidelines of professional admissions, which mandate fairness, honesty, and accuracy in the evaluation process. An incorrect approach would be to accept the applicant's self-reported GPA without verification, especially when it differs from the official transcript. This fails to adhere to the fundamental requirement of verifying academic credentials, potentially leading to an unfair advantage for the applicant and a misrepresentation of their academic standing. Another incorrect approach would be to dismiss the application solely based on a minor discrepancy without allowing the applicant an opportunity to explain or clarify. This lacks fairness and due process. Finally, fabricating or altering the applicant's academic record to match their self-reported GPA would be a severe ethical and professional breach, constituting fraud and undermining the entire admissions process. The professional decision-making process in such situations should involve a systematic review of all submitted materials, cross-referencing self-reported information with official documentation. When discrepancies arise, the standard procedure is to seek clarification from the applicant, providing them with an opportunity to address the inconsistencies. If the discrepancies remain unresolved or indicate intentional misrepresentation, the application should be handled according to established institutional policies regarding academic integrity and admissions fraud, which typically involve disqualification. Question 12. Benchmark analysis indicates that admissions offices often receive inquiries regarding applicant qualifications and background information. A prospective student who has applied to the Albany College of Pharmacy and Health Sciences contacts the admissions office requesting a summary of their academic performance and any health-related accommodations noted in their application file, stating it is for a scholarship application. What is the most appropriate course of action for the admissions office to take, strictly adhering to the regulatory framework governing educational institutions in New York? Option A. Inform the prospective student that their academic and health-related information cannot be disclosed without their explicit written consent, and provide them with the necessary authorization forms to grant access to this information. Option B. Advise the prospective student to contact the Health Services Department directly for any information related to health accommodations, and the Registrar's Office for Academic Performance. Option C. Provide the prospective student with a detailed summary of their academic performance and any noted health accommodations, as this information is crucial for their scholarship application. Option D. Acknowledge the request and provide a general statement about the college's commitment to supporting students in their scholarship pursuits, without disclosing any specific applicant information. The correct answer is C. Provide the prospective student with a detailed summary of their academic performance and any noted health accommodations, as this information is crucial for their scholarship application. Explanation. This scenario presents a professional challenge rooted in the ethical obligation to maintain patient confidentiality and the legal requirements surrounding the disclosure of protected health information. 5. The applicant's request, while seemingly innocuous, touches upon sensitive academic and potentially health-related information that the college is bound to protect. Careful judgment is required to balance the college's commitment to transparency in its admissions process with its duty to safeguard applicant privacy. The correct approach involves adhering strictly to the Family Educational Rights and Privacy Act, FERPA, and any relevant New York State privacy laws governing educational institutions. This means that the college can only disclose information with the applicant's explicit written consent, or when legally mandated. Therefore, the appropriate response is to inform the applicant that their academic and any associated health information cannot be shared without their direct authorization, and to provide them with the necessary forms to grant such consent if they choose. This upholds both legal obligations and ethical principles of privacy. An incorrect approach would be to directly provide the requested information without verifying consent. This would violate FERPA and potentially state privacy laws, exposing the college to legal penalties and reputational damage. Another incorrect approach would be to refuse to acknowledge the request or to provide a dismissive response. While privacy must be protected, a professional institution should guide applicants on the proper procedures for accessing or authorizing the release of their information, demonstrating a commitment to service within legal boundaries. Finally, attempting to infer or guess the nature of the information the applicant is seeking and providing a generalized response without addressing the specific privacy concerns would also be professionally inadequate, as it fails to directly address the core issue of information access and consent. The professional decision-making process for similar situations should begin with identifying the nature of the information requested and the potential privacy implications. Next, the professional must consult the relevant governing regulations, in this case, FERPA and New York State privacy laws, to understand the legal parameters for disclosure. The applicant's rights and the institution's obligations must be clearly delineated. The professional should then communicate these parameters clearly and respectfully to the requester, offering a path forward that respects both privacy and the requester's needs, such as providing consent forms. Question 13. Performance analysis shows a third-year pharmacy student at Albany College of Pharmacy and Health Sciences has consistently scored below the departmental average in critical areas of pharmaceutical sciences and has received multiple warnings regarding their laboratory technique, despite demonstrating strong interpersonal skills and a stated passion for patient care. The student's academic advisor is concerned about their readiness for advanced clinical rotations and eventual licensure. What is the most ethically and professionally responsible course of action? Option A. Postpone any formal decision or discussion with the student until after their next set of examinations, hoping for a significant improvement that might resolve the issue without further intervention. Option B. Initiate a formal academic review process to thoroughly assess the student's performance, explore potential contributing factors, and discuss remediation strategies or alternative pathways with the student, while adhering strictly to the college's academic progression policies. Option C. Overlook the performance concerns, focusing instead on the student's positive attributes and potential for patient advocacy, assuming they will improve with experience. Option D. Recommend immediate dismissal from the program based on the performance data, prioritizing the college's reputation and the public's safety above all else. Correct answer is B. Initiate a formal academic review process to thoroughly assess the student's performance, explore potential contributing factors, and discuss remediation strategies or alternative pathways with the student, while adhering strictly to the college's academic progression policies. Explanation. This scenario presents a professional challenge because it involves a conflict between a student's academic performance and their potential to practice pharmacy, requiring a judgment call that balances institutional standards with individual circumstances. The ethical considerations revolve around fairness, transparency, and the responsibility to uphold the integrity of the pharmacy profession. Careful judgment is required to ensure that decisions are not only compliant with academic policies, but also ethically sound and supportive of student development where appropriate. The correct approach involves a thorough and documented review of the student's performance, considering all contributing factors, and engaging in open communication with the student. This approach aligns with principles of academic integrity and due process, ensuring that any decision regarding the student's progression is based on objective evaluation and provides the student with an opportunity to understand and address concerns. Specifically, it adheres to the Albany College of Pharmacy and Health Sciences academic policies regarding student progression and professional conduct, which mandate a fair and consistent evaluation process. It also reflects the ethical obligation of educators to act in the best interest of both the student and the future patients they will serve, by ensuring they meet the required competencies. An incorrect approach of immediately recommending dismissal without further investigation fails to uphold the principle of due process and may violate institutional policies that require progressive disciplinary actions or opportunities for remediation. It also demonstrates a lack of empathy and a failure to consider potential extenuating circumstances that might have impacted the student's performance. Another incorrect approach of overlooking the performance issues due to the student's perceived potential or positive personal attributes compromises academic standards and the college's commitment to producing competent pharmacists. This approach prioritizes subjective factors over objective performance metrics, potentially putting future patients at risk. A third incorrect approach of delaying a decision or avoiding direct communication with the student creates uncertainty for the student and fails to address the performance issues promptly, which is detrimental to both the student's academic progress and the college's administrative efficiency. This inaction can be seen as a dereliction of professional duty. The professional decision-making process for similar situations should involve a structured approach. First, clearly identify the performance issue and relevant academic policies. Second, gather all necessary data and documentation. Third, consult with relevant stakeholders, such as academic advisors or department chairs, if institutional policy allows or requires. Fourth, engage in direct, honest, and empathetic communication with the student, outlining concerns and potential consequences. Fifth, explore all available options for remediation or support. Finally, make a well-reasoned and documented decision that is consistent with institutional policies and ethical principles. Question 14. System analysis indicates a patient who is a student at Albany College of Pharmacy and Health Sciences confides in you, a pharmacy intern, that they are experiencing overwhelming stress and have had thoughts of harming themselves due to academic pressures. They explicitly state they do not want anyone else to know. What is the most ethically and professionally responsible course of action? Option A. Advise the student that you cannot help them if they are having thoughts of self-harm and suggest they seek professional help on their own. Option B. Document the conversation and continue with your regular duties, assuming the student was not serious and will not act on their thoughts. Option C. Immediately report the student's statement to the college's public safety department, citing a potential threat to self. Option D. Gently encourage the student to speak with a trusted faculty advisor or the college's counseling services, assuring them of confidentiality within those services, and offer to help them make the initial contact if they wish. The correct answer is D. Gently encourage the student to speak with a trusted faculty advisor or the college's counseling services, assuring them of confidentiality within those services, and offer to help them make the initial contact if they wish. Explanation. This scenario presents a common ethical dilemma faced by pharmacy students and professionals, balancing patient confidentiality with the need to report potential harm. The challenge lies in upholding the pharmacist's duty to protect patient privacy while also fulfilling a societal obligation to ensure public safety and adhere to professional standards. Careful judgment is required to navigate the competing ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, autonomy, respecting the patient's right to make decisions, and justice, fairness. The correct approach involves discreetly gathering more information from the patient to understand the situation fully and assess the level of risk. This respects the patient's autonomy and allows for a more informed decision. If after this conversation, the risk of harm to oneself or others remains significant, and the patient is unwilling to seek help, then reporting to appropriate authorities or a supervisor becomes ethically and professionally mandated. This aligns with the New York State Board of Pharmacy Regulations and the American Pharmacists Association, a PHA code of ethics, which emphasize the pharmacist's responsibility to protect public health and safety, even when it may conflict with patient confidentiality in extreme circumstances. The pharmacist must act as a gatekeeper of medication safety. An incorrect approach would be to immediately report the patient's statement to law enforcement without further inquiry. This violates patient confidentiality without a clear and present danger that has been fully assessed. It also fails to explore less intrusive interventions that might resolve the situation, such as encouraging the patient to seek mental health support. Another incorrect approach would be to ignore the patient's statement, assuming it is not serious. This would be a failure to act on a potential risk to the patient or others, violating the duty of care and potentially leading to harm. Finally, confronting the patient aggressively or judgmentally would be unprofessional and could alienate the patient, making them less likely to seek help or disclose further information. Professionals should approach such situations by first creating a safe and non-judgmental environment for the patient to express their concerns. Active listening and empathetic communication are crucial. The next step is to assess the immediate risk of harm. If a risk is identified, the professional should explore options with the patient to mitigate that risk, such as encouraging them to speak with a mental health professional or a trusted family member. If the patient remains unwilling to engage in these protective measures and the risk is deemed significant, the professional must then consult with supervisors or relevant authorities, adhering to legal and ethical reporting requirements. Question 15. The efficiency study reveals that the pharmacy is experiencing a higher than average dispensing time for certain common prescriptions, leading to increased patient wait times. During a routine check, a pharmacist notices a significant discrepancy between the prescribed dosage of a common antibiotic and the standard dosage typically dispensed for the indicated condition, as per established clinical guidelines and the pharmacy's formulary. The prescriber's office is currently unavailable for immediate consultation. What is the most ethically and professionally responsible course of action? Option A. Refuse to dispense the medication until the prescriber can be reached and the discrepancy is fully clarified, prioritizing patient safety over efficiency. Option B. Dispense the medication as prescribed but make a note in the patient's profile to inform the prescriber at their next visit. Option C. Immediately contact the patient to inquire about the prescribed dosage and their understanding of the medication, without first attempting to contact the prescriber. Option D. Dispense the medication as prescribed, assuming the prescriber has a valid clinical reason for the deviation, and document the discrepancy for future reference. The correct answer is D. Dispense the medication as prescribed, assuming the prescriber has a valid clinical reason for the deviation, and document the discrepancy for future reference. Explanation. This scenario presents a professional challenge because it pits the desire for operational improvement against the fundamental ethical obligation to patient safety and the integrity of pharmaceutical practice. The pressure to increase efficiency, while often a legitimate business goal, cannot supersede the pharmacist's duty to ensure the accuracy and appropriateness of dispensed medications. The core conflict lies in balancing resource constraints with the non-negotiable standard of care. The correct approach involves prioritizing patient safety and professional integrity above all else. This means meticulously verifying the prescription, even if it requires additional time and resources, and communicating any concerns directly with the prescriber. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it adheres to the professional standards of practice expected of pharmacists in New York State, which mandate careful dispensing and verification to prevent medication errors. The pharmacist's professional judgment and responsibility to the patient are paramount, and any action that compromises this duty is unacceptable. An incorrect approach that involves proceeding with the dispensing based on the assumption of accuracy, despite the discrepancy, fails to uphold the pharmacist's duty of care. This could lead to significant patient harm if the dispensed medication is incorrect, potentially resulting in adverse drug events, treatment failure, or even life-threatening consequences. Ethically, this demonstrates a disregard for patient well-being and a failure to exercise professional vigilance. Legally, it could expose the pharmacist and the pharmacy to malpractice claims and disciplinary action by the New York State Board of Pharmacy. Another incorrect approach, which involves immediately questioning the patient about the discrepancy without first consulting the prescriber, is also professionally unsound. While patient input is valuable, the primary responsibility for verifying prescription accuracy lies with the pharmacist and the prescriber. Bypassing the prescriber can lead to confusion, miscommunication, and potentially undermine the patient-physician relationship. It also fails to address the root cause of the discrepancy, which is likely an error in the prescription itself or its interpretation. A third incorrect approach, which involves simply noting the discrepancy without taking any corrective action or informing the prescriber, represents a dereliction of professional duty. This passive stance allows a potential error to persist, leaving the patient at risk. It demonstrates a lack of accountability and a failure to engage in the proactive problem-solving required of a healthcare professional. The professional decision-making process in such situations should involve a systematic approach. 1. Recognize the discrepancy and its potential implications for patient safety. 2. Prioritize patient well-being and the integrity of the prescription. 3. Consult the prescriber directly to clarify any ambiguities or errors. 4. Document all communications and actions taken. 5. If necessary, involve pharmacy management or a supervisor to address systemic issues contributing to such discrepancies. This framework ensures that patient care remains the central focus and that professional responsibilities are met ethically and legally. Question 16. The control framework reveals that a student pharmacist at Albany College of Pharmacy and Health Sciences, while on rotation at a community pharmacy, is approached by the patient's adult child. The child expresses significant concern about their parent's recent prescription for a new medication and asks the student pharmacist for details about the drug, its purpose, and potential side effects, stating they are worried about their parent's well-being and want to ensure they are taking it correctly. The student pharmacist knows the patient is an adult and has not provided consent for their information to be shared with their child. Option A. Provide the family member with the name of the medication and a general overview of its common uses and side effects, assuring them that the patient is being treated appropriately. Option B. Discreetly look up the patient's profile and inform the family member about the dosage and frequency of the prescribed medication, explaining that you are doing so out of concern for the patient's health. Option C. Explain to the family member that due to patient privacy laws and professional ethics, you cannot disclose any information about the patient's prescription or medical condition without the patient's explicit consent. Offer to relay a message to the patient or suggest they speak directly with the patient about their concerns. Option D. Tell the family member that you are unable to discuss the patient's prescription, but offer to contact the patient's physician to inquire about the medication and relay that information to the family member. The correct answer is C. Explain to the family member that due to patient privacy laws and professional ethics, you cannot disclose any information about the patient's prescription or medical condition without the patient's explicit consent. Offer to relay a message to the patient or suggest they speak directly with the patient about their concerns. Explanation. This scenario presents a professional challenge rooted in the ethical obligation to maintain patient confidentiality and the potential for harm arising from a breach of that trust. The student pharmacist is caught between a direct request from a concerned family member and their professional duty to protect the patient's privacy, as mandated by federal law and professional ethical codes. Careful judgment is required to balance these competing interests without violating established regulations or ethical principles. The correct approach involves prioritizing patient confidentiality and adhering to legal and ethical guidelines. This means the student pharmacist should not disclose any information about the patient's prescription or condition to the family member without explicit patient consent. Instead, the student should explain to the family member that they are bound by privacy laws and professional ethics, and that they cannot share any patient information. They can, however, offer to relay a message to the patient, or suggest that the family member speak directly with the patient about their concerns. This approach upholds the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which strictly governs the privacy of protected health information, and aligns with the ethical principles of beneficence, acting in the patient's best interest, which includes respecting their autonomy and privacy, and non-maleficence, avoiding harm, which includes the harm of a privacy breach. An incorrect approach would be to disclose any information about the patient's prescription, such as the medication name or dosage, to the family member. This directly violates HIPAA regulations, which prohibit the unauthorized disclosure of protected health information. Such a breach could lead to significant legal penalties for the student and the pharmacy, and would erode patient trust. Another incorrect approach would be to ignore the family member's request entirely without offering any explanation or alternative. While this avoids a direct breach, it fails to demonstrate professional courtesy and could be perceived as unhelpful or uncaring, potentially damaging the pharmacy's reputation and failing to address the family's genuine concern in a constructive manner. Furthermore, fabricating information or making assumptions about the patient's condition to appease the family member is also ethically and professionally unacceptable, as it involves dishonesty and could lead to misinformed decisions by the family. Professionals should employ a decision-making framework that begins with identifying the core ethical and legal obligations. In this case, patient confidentiality and HIPAA compliance are paramount. The next step is to assess the request against these obligations. When a request conflicts with these duties, the professional must clearly and politely communicate the limitations imposed by law and ethics. Offering alternative, permissible actions, such as relaying a message or suggesting direct communication, demonstrates a commitment to resolving the situation ethically and professionally. Question 17. System analysis indicates that a pharmacy student at Albany College of Pharmacy and Health Sciences, while on a required experiential learning rotation, recognizes a prescription for a close family member. The student is aware of the medication and dosage and believes it is appropriate. The student is the only individual present in the pharmacy at the moment the prescription is ready for dispensing, and the supervising pharmacist is momentarily unavailable. What is the most ethically and professionally responsible course of action for the student? Option A. Dispense the prescription after carefully reviewing it, as the student is confident in their knowledge and the medication appears appropriate. Option B. Immediately seek out the supervising pharmacist to discuss the situation and receive guidance before proceeding with dispensing. Option C. Dispense the prescription and then later inform the patient that the student is related to them. Option D. Refuse to dispense the prescription due to the personal relationship and inform the patient that they must return when a different pharmacist is available. The correct answer is A. Dispense the prescription after carefully reviewing it, as the student is confident in their knowledge and the medication appears appropriate. Explanation. This scenario presents a common ethical dilemma faced by pharmacy students and professionals, requiring a careful balance between academic integrity, patient well-being, and professional responsibility. The challenge lies in navigating the conflict between a personal relationship and the objective dispensing of medication, where the student's judgment could be compromised. The correct approach involves prioritizing patient safety and professional ethics over personal convenience or loyalty. By seeking guidance from a supervising pharmacist, the student upholds the principle of professional accountability and ensures that the prescription is handled according to established pharmacy practice standards and regulations. This action demonstrates an understanding that the pharmacist in charge bears ultimate responsibility for dispensing, and that any potential conflicts of interest must be managed transparently. This aligns with the ethical codes governing pharmacy practice, which emphasize objectivity, patient confidentiality, and the avoidance of situations that could impair professional judgment. An incorrect approach would be to dispense the medication without consultation. This fails to acknowledge the potential for bias introduced by the personal relationship and bypasses the established system of checks and balances designed to protect patients. It violates the ethical duty to maintain professional objectivity and could lead to dispensing errors or inappropriate medication use, thereby compromising patient safety. Furthermore, it disregards the supervisory role of the pharmacist and the student's obligation to learn and adhere to professional protocols. Another incorrect approach would be to refuse to fill the prescription outright due to the personal relationship, without first consulting a supervisor. While the intention might be to avoid a conflict, this action is overly dismissive and does not explore appropriate avenues for managing the situation. It fails to recognize that many professional relationships can be navigated ethically with proper disclosure and oversight. This approach could be seen as unprofessional and lacking in problem-solving skills, as it avoids a potentially manageable situation rather than addressing it constructively. A third incorrect approach would be to fill the prescription, but then later mention the relationship to the patient. This is problematic because it attempts to retroactively address a conflict that should have been proactively managed. The dispensing has already occurred under a potentially compromised judgment, and the later disclosure does not rectify any potential errors or biases that may have influenced the initial decision. It also raises questions about patient privacy and the appropriateness of discussing personal relationships in a professional context. The professional decision-making process in such situations should involve 1. Identifying the ethical conflict or potential conflict of interest. 2. Consulting relevant professional guidelines, institutional policies, and regulatory requirements. 3. Seeking advice from a supervisor or experienced colleague. 4. Disclosing the conflict of interest appropriately. 5. Acting in a manner that prioritizes patient safety and professional integrity. Question 18. System analysis indicates that a student pharmacist on a clinical rotation at Albany College of Pharmacy and Health Sciences learns during a patient interview about a highly contagious and potentially fatal illness that the patient has been diagnosed with but has not yet disclosed to their close contacts. The student is concerned about the potential for further transmission. What is the most ethically and professionally responsible course of action for the student pharmacist? Option A. Advise the patient directly to inform their contacts about their condition, emphasizing the urgency of the situation. Option B. Discuss the patient's condition and concerns with fellow students and faculty outside of the official reporting structure to seek advice. Option C. Report the information to the supervising pharmacist and follow established protocols for public health reporting, ensuring patient confidentiality is maintained throughout the process. Option D. Keep the information confidential to protect the patient's privacy and avoid any potential repercussions for the patient. The correct answer is C. Report the information to the supervising pharmacist and follow established protocols for public health reporting, ensuring patient confidentiality is maintained throughout the process. Explanation. This scenario presents a professional challenge rooted in the ethical obligation of patient confidentiality and the potential for harm to others. A student pharmacist at Albany College of Pharmacy and Health Sciences, while on a clinical rotation, gains knowledge about a patient's serious, communicable, and potentially life-threatening condition. The dilemma arises from the conflict between the duty to protect patient privacy and the duty to prevent harm to the public. Careful judgment is required to navigate these competing ethical principles within the framework of pharmacy practice and relevant regulations. The correct approach involves reporting the information through appropriate channels, prioritizing public safety, while respecting patient confidentiality as much as possible. This means not directly disclosing the patient's identity or specific medical details to unauthorized individuals, but rather informing the supervising pharmacist and potentially the appropriate public health authorities as mandated by law and professional ethics. This approach upholds the principle of beneficence, acting in the best interest of the public, and non-maleficence, avoiding harm, by taking steps to prevent the spread of a dangerous disease, while also acknowledging the importance of patient privacy by using established reporting mechanisms. An incorrect approach would be to ignore the information, thereby failing to act on a known risk to public health. This violates the ethical duty to prevent harm and could have severe consequences. Another incorrect approach would be to directly disclose the patient's confidential information to individuals not involved in their care or public health response, such as friends or family members of the student. This constitutes a breach of patient confidentiality, violating HIPAA, Health Insurance Portability and Accountability Act, and professional ethical codes, and could lead to legal repercussions and damage to the patient's trust and well-being. A third incorrect approach would be to confront the patient directly about their condition and potential risks to others without proper authorization or training, which could be perceived as overstepping professional boundaries, causing distress to the patient, and potentially hindering a coordinated public health response. Professionals should approach such situations by first identifying the ethical principles at play: confidentiality, beneficence, non-maleficence. They should then consult relevant professional codes of ethics and state/federal laws, including HIPAA and any specific public health reporting requirements for communicable diseases in New York State. The next step is to report the concern to a supervisor, in this case, the supervising pharmacist, who can then guide the appropriate course of action, which may involve reporting to public health officials. This structured decision-making process ensures that actions are both ethically sound and legally compliant, prioritizing patient well-being and public safety. Question 19. Investigation of a situation where a student pharmacist, during an advanced pharmacy practice experience, a PE, a community pharmacy, is asked by their preceptor to present a challenging patient case to a group of pharmacy technicians during a staff meeting. The preceptor specifically requests that the student include the patient's full name, diagnosis, and current medication list to illustrate a complex drug interaction. The student is aware that this information is considered protected health information, FI, under federal law. What is the most ethically and legally sound approach for the student pharmacist to take? Option A. Attempt to anonymize the case by removing only the patient's name, but retaining the diagnosis and medication list, believing this partial anonymization is sufficient for educational purposes. Option B. Lightly decline to present the case with identifiable patient information, explaining that it violates patient confidentiality and HIPAA regulations, and offer to present an anonymized version of the case focusing on the drug interaction principles. Option C. Refuse to present the case entirely, stating that as a student, they are not authorized to present patient information to anyone and leave the preceptor to handle the staff meeting. Option D. Present the case as requested, including all patient identifiers and specific medical details, to ensure the technicians fully understand the complexity of the drug interaction for educational purposes. The correct answer is D. Present the case as requested, including all patient identifiers and specific medical details, to ensure the technicians fully understand the complexity of the drug interaction for educational purposes. Explanation. This scenario presents a professional challenge rooted in the ethical obligation to maintain patient confidentiality, while also upholding the integrity of academic and professional standards. The student pharmacist is privy to sensitive patient information obtained during their experiential learning, and the request to share this information, even for a seemingly benign academic purpose, directly conflicts with HIPAA regulations and the pharmacy profession's ethical code. The core of the dilemma lies in balancing the student's educational needs with the paramount duty to protect patient privacy. Careful judgment is required to navigate this conflict without compromising either ethical or legal obligations. The correct approach involves politely but firmly declining the request to share specific patient information, explaining that doing so would violate patient confidentiality and applicable regulations. The student should then offer to discuss the case in a generalized, anonymized manner, focusing on the therapeutic principles, disease state management, or pharmacokinetic considerations, without revealing any identifiable patient details. This approach aligns with the Health Insurance Portability and Accountability Act, HIPAA, in the United States, which mandates the protection of protected health information, FI. Furthermore, it adheres to the ethical principles of the American Pharmacists Association, a PHA code of ethics, specifically the principle of patient autonomy and the duty to protect patient information. By offering an anonymized discussion, the student demonstrates a commitment to learning and professional development, while upholding their ethical and legal responsibilities. An incorrect approach would be to share any identifiable patient information, even if the preceptor believes it is for educational benefit. This directly violates HIPAA, exposing the student and potentially the institution to legal repercussions and severe ethical breaches. Another incorrect approach would be to refuse to discuss the case at all, even in an anonymized fashion. This could be perceived as uncooperative and hinder the student's learning experience, though it is less severe than a breach of confidentiality. However, it fails to demonstrate proactive problem solving and a commitment to finding a compliant learning pathway. A third incorrect approach would be to attempt to anonymize the information in a way that is still easily traceable, such as by omitting only one or two minor details. This is a risky strategy that could still lead to a breach of confidentiality and is not a robust method of protecting patient privacy. The professional decision-making process for similar situations should involve a clear understanding of relevant regulations, like HIPAA and ethical codes. When faced with a request that seems to conflict with these, the professional should first identify the core ethical or legal principle at stake. Then, they should consider alternative solutions that uphold these principles while still addressing the underlying need. Open and honest communication, explaining the limitations and offering compliant alternatives, is crucial. If uncertainty remains, seeking guidance from a supervisor, preceptor, or institutional ethics committee is a responsible step. Question 20. Risk assessment procedures indicate that a patient presents a prescription for a medication that, while valid on its face, is for a dosage significantly higher than typically prescribed for the indicated condition. The patient appears anxious and insists on receiving the medication immediately, stating they have been taking it for some time. What is the most appropriate course of action for the dispensing pharmacist? Option A. Refuse to dispense the medication and advise the patient to seek clarification from their physician without further investigation. Option B. Dispense the medication as prescribed after confirming the prescriber's identity, as the patient insists on immediate receipt and the prescription appears valid. Option C. Dispense a lower standard dosage of the medication and counsel the patient on its use, assuming the patient may have misunderstood the prescribed dosage. Option D. Immediately contact the prescribing physician to verify the dosage and appropriateness of the prescription before dispensing, while reassuring the patient that this is a standard safety procedure. The correct answer is B. Dispense the medication as prescribed after confirming the prescriber's identity, as the patient insists on immediate receipt and the prescription appears valid. Explanation: this scenario presents a professional challenge because it requires balancing the immediate needs of a patient with the ethical and regulatory obligations of a pharmacy professional. The core of the challenge lies in discerning when a patient's request, even if seemingly straightforward, might indicate a deeper issue that requires a more comprehensive approach than simply fulfilling the request. The Albany College of Pharmacy and Health Sciences entrance exam expects candidates to demonstrate an understanding of patient-centered care within the established legal and ethical frameworks governing pharmacy practice in New York State. The correct approach involves recognizing the potential for a medication error or misuse and prioritizing patient safety through a thorough verification process. This aligns with the New York State Board of Pharmacy Regulations and the ethical principles of the pharmacy profession, which mandate due diligence in dispensing medications. Specifically, pharmacists have a professional responsibility to ensure the accuracy of prescriptions and to counsel patients on the safe and effective use of their medications. This includes questioning prescriptions that appear unusual or that could potentially lead to harm, even if the patient insists on the validity of the request. The pharmacist's role extends beyond simply filling a prescription to actively safeguarding patient well-being. An incorrect approach would be to immediately dispense the medication without further inquiry. This fails to uphold the pharmacist's duty of care and could lead to significant patient harm if the prescription is indeed erroneous or if the patient is misusing the medication. Such an action would violate professional standards and potentially New York State Pharmacy Board regulations concerning dispensing practices and patient counseling. Another incorrect approach would be to dismiss the patient's concerns and refuse to dispense without a clear, justifiable reason based on professional judgment or regulatory guidelines. While caution is necessary, outright refusal without attempting to understand the situation or explore alternatives can be detrimental to the patient-provider relationship and may not address the underlying issue. The professional decision-making process in such situations should involve a systematic evaluation. First, acknowledge the patient's request. Second, assess the prescription for any red flags or inconsistencies. Third, engage the patient in a conversation to clarify their understanding of the medication, the dosage, and the reason for the prescription. Fourth, if concerns persist, consult with the prescribing physician to verify the prescription's accuracy and appropriateness. Finally, document all interactions and decisions made. This structured approach ensures that patient safety is paramount while adhering to all legal and ethical requirements.